Oborwaire bwa Kansa bogenderete kogosereria amagima y'abana inchi ensengima nige serikali ya kaunti ya Kisii KOBWATERANA university ya Kisii nigo ritukuria rero bachakibera no omoroberi bw'obotuki na koira omubaro bw'abarwaire ba Kansa erikuriga chinchira cyo KOBWATERANA na babwatene ao erigukinia chinchira bakonyora obobwenia gukwana se university yo mubaso orera babwatene ao nigo batebiruna engenchonero yo gukora obotuki bw'omwenderete erigukora omuchando oyoiga bw'oborwaire bwa Kansa Nonya nabo nigo batebiruna Kansa yorobere nigo egenderete koba okugosereria okonene na igo nibwenderete kurigerigwa chinchira cyokuyekora.
We are partnering with the county government of Kisii in handling the health matters. As you all know, health is a devolved function, and we are partnering with the county government of Kisii in this. And in developing our niche on cancer research and management, we are currently engaging various stakeholders and organizing seminars, workshops, and meetings.
My name is Dr. Bahati. I'm an oncoplastic breast surgeon based at the Kisii Teaching and Referral Hospital. I had the pleasure of attending the workshop that was held in Kisii University earlier this week, and we had fantastic discussions that were looking at the burden of cancer globally and more so in Kisii. We know that cancer is becoming a global burden with rising cases, and the same is also being mirrored in Kenya. In Kisii too, we are making strategies to see whether we can increase our data collection on cancer. Currently, Kisii Teaching and Referral Hospital, in conjunction with Kisii County, has partnered with the University of Manchester, and we are now establishing a cancer registry to be able to collect this data. So far, the efforts that have been done, we have some statistics that show us what the 5 leading cancers in Kisii are. First on the list is breast cancer, closely followed by cervical cancer. Esophageal cancer is the 3rd one, colorectal the 4th one, and prostate being the 5th cancer that we are seeing county. There will be hospital-based cancer registries, meaning we'll be recording incidences of cancer of all patients seen in these facilities, whether they've come from Kisii County or from the surrounding counties around here. I believe this is one of the best ways to curb this rising burden of cancer by having data that will guide us to make evidence-based decisions. Thank you.
Kisii serves almost like 9 counties as a referral. So we have a prostate, breast, cervical cancer, esophagus. They are big, and the numbers are actually big, as maybe the oncologists will find out. They are big, and it's really becoming important that we get everything right.